When the numbers start rolling, that means that this is.
Treasure Coast Connector, connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Well, welcome to Treasure Coast Connector. I'm your host, Ellen Contreras, and I'm pleased to announce that Treasure Coast Printers is one of our sponsors. They're a one-stop shop for all your printing needs: brochures, business cards, flyers, banners, signs, promotional items, and more. www.treasurecoastprinters.com is their website. Their phone number, 772-202-2721. There is a promo code TCC2020 for 10% off your entire order. This company, they're fast, they're local, they're high-tech, and they're competitively priced. So Treasure Coast Connector is a show that puts a spotlight on local business owners. We want to know their backstory, why they started their business, what makes their products and services so unique and special. On today's show, we're going to learn about a clinic located in St. Lucie County, where they are filling a void in medical care from the perspective of a family medicine physician. Dr. McCain, Jessica Mccain, is the founder of Southern Comfort Medical Marijuana Clinic, and there's two locations, one in Fort Pierce, one in Port St. Lucie. Dr. McCain and her team put together a high level of compassionate care in a non-judgmental and safe environment. Also in the studio is Veronica Kolobab, and she is the clinic's Director of Business Development. So welcome, ladies.
Oh, thank you, Ellen.
It's a pleasure.
Thank you, Ellen.
To have you guys on the show. And we're going to start with Dr. Jessica McCain.
Sure.
My very first question is always the why. What made you want to become a cannabis physician?
Well, it certainly wasn't the direction my medical education sent me. My formal education did not include anything about medical cannabis. And I had the same education that generally the public has, that, cannabis is only illicit drugs. Marijuana is only a recreational drug. And even more so because I grew up in a family of bail bonds. So I knew that there was consequences to drug use.
Yes.
And when I was in medical school, there was actually a couple of failed elections trying to make medical marijuana legal in Florida before it passed in November of 2017. So I started educating myself because I wanted to be a responsible voter, but I also wanted to be a responsible physician. If there was an option for my patients, I needed to learn about it.
Oh, sure.
There was a defining moment I had after I left and I started practice, and I had a patient that had colon cancer, rectal cancer, actually. And he was in so much pain, he couldn't sit down, and he needed pain management. His mother, who was in her 80s, very feeble herself, was demanding that he takes pain medicine, but he refused because he knew he needed to say goodbye, and he couldn't be of the right mindset in order to say goodbye, and people were flying in. So it was like that evening I went home, started learning about the legalities. Could I even talk about this? And the law hadn't even passed yet. What is the science behind it? And I started realizing there is some science. There's really a lot of research about this,
absolutely.
and it is definitely a potential medicine. So my husband, Brett, who's also our CEO, he was really skeptical that this is just a path to recreational cannabis. And we actually attended a conference where we heard other patients speak about it, and it really just resonated with us. And it was there that I met my mentor, Dr. Dustin Sulak, who's considered an international cannabis expert. And so he's been my mentor and kind of guided me through the whole process. So that's kind of how I got started with it.
Well, that is wonderful. So that is a good why for the driving force behind opening up a clinic, because you felt that there was a need in this area. And if there's one thing that you want people to understand about the importance and the validity of medical marijuana use, let's talk a little bit about that, of why you opened the clinic.
So I actually really enjoy doing public speaking engagement. I've done a couple of community advocacy groups and support groups. And one thing I always start with is talking about the history. I like to say you don't know where you're going until you know where you're coming from. And so learning that this actually, marijuana, medical cannabis, was actually prescribed thousands of years, even less than a century ago. It was commonly prescribed for a lot of different ailments. But then the government got involved, and we've got propaganda. And ultimately the loss of medicine. This is why now a whole generation of physicians don't really understand how to use cannabis in a medical fashion. But now that technology is caught up, we have irrefutable evidence of the mechanisms, of the pharmacology of how cannabis can actually treat medical conditions and provide relief. So I like to really just dispel the beginning myths that this is just for adult use, it's just recreational. No, the science is there, and we actually have seen data that shows that it can be definitely for a more medical use. Cannabis is a complex plant, actually, but it can be used very, very simply. And there's definitely some strategy. There's a pop culture strategy, but again, a scientific strategy. So I just like to educate patients that there's a safe way. It's a very safe drug to use and experiment with, and it can be used in lieu of a lot of other medicines that may not have the same safety profile.
So, and it's wonderful that you have gone through so much research and training and development on this so that you are the quintessential professional in this industry. So, and that's wonderful that you've opened up the clinic in Fort Pierce and Port St. Lucie. But now let's just say that I have a medical condition of some sort, which I don't, but, I have a friend on the West Coast who has an autoimmune disease. So, and it's amazing what that has done for her. And that was a wake up call for me. So then when I met you, I was like, you need to tell everybody. So now if I were to call you to say, this is what I'm suffering from, I don't know if this can help me. What now that I've made that phone call, what is the process?
So Florida didn't make it very simple. It's actually kind of a little bit of a complicated process. But after 3 years of doing this now and practicing at Southern Comfort, we've really simplified it, and we can make it a very comfortable and really straightforward for the patients. So they feel pretty comfortable when they leave. Basically, you have to first have a diagnosis that would qualify. And there's actually 10 listed conditions that the state would say is automatically qualifying. But there's actually an asterisk. Number 11 gives the physician the privilege or the opportunity to say, no, a patient has a chronic condition, it's debilitating, and it's very similar to the other ones. What we do is we would submit extra legal paperwork and research studies to the state to authorize outside of those 10 conditions. But those 10 conditions would be glaucoma, cancer, seizure disorder, ALS or like Lou Gehrig's disease, multiple sclerosis, Crohn's disease, HIV, PTSD, Parkinson's disease, or just any terminal condition. So there's like a set list of conditions, but again, physicians can use outside of that if someone does have chronic pain because of pinched nerves, or if they have anxiety or depression, or a lot of other conditions would qualify based on the Florida statute. So once we have medical records, then we meet with the physician, myself, and I have another physician that works with me, Dr. Nick Lazama.
Yeah, very nice man.
Yes, and when it's an in-person visit, it has to be with an MD or a DO. The law is that it cannot be through telemedicine, it has to be a physical inpatient visit.
Okay.
And what we do then is we educate about the different process, what's the best strategy for use. We help register you with the state. And then there's actually a separate process to finish the ID card, which gets printed by the Department of Health in Florida. So that's a separate process. We put in orders, which are pretty much permissions of what a patient is allowed to purchase at the dispensary, but the state actually expires those after 210 days. So you have to do this process every 7 months with a physician to get recertified almost, and then every 12 months doing it with the state to get an ID card renewed. So what we like to do is just handhold patients. It sounds very complicated, but it's really not that bad if we have someone that can guide you from the moment of gathering records to finishing your state application. And that's generally what we do.
Well, that is wonderful. And it's nice to know that, people can't just say, well, I think I have some back pain and that's what I need. So it's very good. It's to prevent people from using it, misusing it is the better way to say it. And so now, the people are protected from, never mind. I could just go on, and I'm not going to do that. But you know what I do want to do, believe it or not, is I'm going to take a break a little bit early because we have so much more to talk about that I want to make sure that I get all this in. So Dr. McCain, Jessica McCain of Southern Comfort Medical Marijuana Clinic, and Veronica Kolobab, Director of Business Development, we have so much more to discuss when we return. Stay tuned. Want to
be a worldwide media mogul? Call Planet Vero Radio now, 778-2832, and be on 3 iHeart radio stations plus live video streaming.
Are you an artist wannabe? Come dabble in color. Never painted before? Come dabble in color. Dabble in color. Always wanted to paint but afraid you can't? Come dabble in color. We do private parties and events all all over the county. dabbleandcolor.net.
Take a new direction with your pest control needs. Call Compass Pest Control. Hi, I'm Chris Hudman, co-owner of Compass Pest Control. We're not your ordinary pest control company. We have over 60 years of local experience. We know service after the sale is the most important part of our business. Call us at 925-1740. That's 772-925-1740, or on the web at compasspests.com. That's compass, PESTS.com.
For those tired of staring at laundry as it piles up, the answer is usually putting it off as long as possible. For most, there's not just another minute to squeeze into a day to get the laundry done. Sunshine Laundries can help. This is Tom Rhodes, owner of Sunshine Laundries, with a reminder that 5 of our locations offer drop-off service. We'll wash, dry, and fold. For locations and hours, we're at sunshinelaundries.com, and with laundromats all along the Treasure Coast.
You're listening to Planet Vero Radio, 1370 AM, 107.9 FM, Real Radio, 101.7 FM, and of course, heard round the world on iHeartMedia. We podcast, too. I hate to interrupt your listening to Planet Vero right now, but we want to make sure that you understand that the shows that you're listening to were pre-recorded last week, and you'll be hearing things that might have been canceled. So anything you hear on Planet Vero this week, basically, and you're interested in going to the event, please call the venue of the event to make sure that it's still going on. There has been a lot of cancellations. We thank you, and we hope our listeners stay nice and safe.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras. Treasure Coast Printers is one of the sponsors. And in the studio with me today for the second half of the show to continue the conversation is Dr. Jessica Mccain and Veronica Kolobab. And Dr. McCain is the founder of Southern Comfort Medical Marijuana Clinic. Veronica Kolobab is the Director of Business Development. We had a lot of great information about your practice. So what I'd like for you to do is tell everyone your contact information.
Okay, so we are located in St. Lucie West. We are going to be moving to a more central location in Port St. Lucie in the future, but details to be announced. And we also have a location in Fort Pierce at South 7th Street. To get that information of where we're located, I think you best to go to our website, www.socommjclinic.com, or call our phone number, 772-218-7262.
Well, that's wonderful. Congratulations on the move. I know you're getting ready to do that. So prior to the break, we were talking about the fact that people have to see you as the physician. They have to be qualified. And then in order to get the order sets to go to a dispensary, it's every 210 days. And then once a year for the card, the ID card that's through the Department of Health, is
correct.
It?
And that's a $75 application fee.
Okay, so this is what I wanted to get into, is the fact that I have heard all of these conflicting things of people seem to be paying through the nose. They're told that they have to pay so much money and go for all of these visits, and that's not necessary. So you have really streamlined the process. You don't nickel and dime people. So can you explain some of the misinformation?
Sure. I mean, I guess when we started putting pen to paper and we wanted our business model, we asked ourselves, what is our goal? What's our mission statement? And we wanted to be accessible, affordable, and we wanted to be advocates for our patients. So we have tried to maximize, what the law allows and put in order sets for 210 days. And we do that because when you come to our clinic, we provide such great education. We get compliments all the time that, their other doctors didn't do it, even in other states. But we want to make it the value worth it for the patient. Right. But we have heard that some patients find their doctors maybe hold them a little bit hostage. They have to come in every 30 days, every 60 days, another fee, or maybe they didn't realize the price advertised on the website was the doctor's visit, but not the order set. That's extra. So we hear all these kind of little things, but we really try to emphasize price transparency. We're a family-run business, and that's actually pretty unique for this type of establishment here in Florida as well. So we're a little bit savvy, cost-conscious, and we, do every little thing we can to keep the price low for patients, even if it's like paperless charts or things like that. So that's one way that we try to help our patients. And then just talking about the value again, if someone feels like they need a little bit more assistance, we offer free email consults for our patients. If they want to bring in their whole bag of medicine and, we can talk to them how to dilute it or make it cheaper or make it more effective, they can come in for consult visits in between before the 210 days if they need to.
That's very nice, because even with, like my husband had a blood pressure medication that needed to be adjusted. So there were a couple initially visits that he had to go in for, right? So it's the same concept. So if someone gets an order set, and then it's just not quite right, you will still work with them to help them figure things out.
Exactly. I think the average patient may take even a month before they get a good day-to-day routine going. So we tell them at the end of 2 weeks, if you're feeling like you're not headed in that direction, let us know. We want to know. We want to see good success rates. Yeah. And I think we have pretty good success rates because we are pretty proactive about that.
Well, very good. So now I want to talk about the delivery method, because obviously a lot of people like myself thought there was just one way that you would get medical marijuana into your system, but that is so not true. So explain that.
So I have some patients come and maybe they hesitated even approaching us because they have lung disease and they don't think that this is for them. But don't make that a limiting factor. There's actually a lot of different ways you can use cannabis as medicine, and innovation, again, and technology keeps expanding it. So if we just get into the most primitive way, using the flower, that's what the state calls it, or bud, you can smoke it or vaporize it. Those are actually two different methods. You can actually even eat it raw and get benefits. Don't even have to get high with the raw version. You can't actually. You can use the liquid extract to vaporize the liquid extract. You have nasal sprays. They even have inhalers now. Drops that go under the tongue, mints that dissolve. Oral edibles, capsules, lotions, creams, patches, suppositories. So really, the reason why I run down that list is because we have to remember that variety is the spice of life. And with each method, actually, you get different properties, different time frames, how fast it will kick in, how long it will last. So are you really trying to just get a quick fix to move on to your next destination? Or are you using it really to try to mitigate disease process? Patients may use more than one method because of the different time frames, but also the different chemicals. Each method gets processed in your body differently, whether it's straight to the bloodstream or through the liver. And then each chemical will interact with different receptors. So patients may use more than one method just to get the full experience.
Wow, that is wonderful. And it's so nice to know that you have that time and patience as a family medicine physician, that's your approach. You really want, it's the quality of life. That is what
ultimately that is what drives me every day at the end, with the thank yous that we get. And it's really, that's what we do at our clinic, help people with their quality of life.
And we're going to get to that in a moment. But the 420 event, let's just throw the spotlight on Veronica Kolobab. Tell us about this, please.
Well, the 420 event's probably something that's maybe never been done the way we're going to do it this year.
Okay.
We have a band. We're having a photo booth. We have a lot of activities, face painting, henna, a lot of great vendors. Probably 10 of the 12 dispensaries will be there to discuss with patients the different delivery methods, the different medications that are available to them. So it's going to be a big fun production, but very educational. We'll have breakout sessions.
And fun.
Yes.
That's Veronica Kolobab. That's you.
Well, we will have breakout sessions.
Okay.
We will, the top sponsors will also
who are they?
be. Yeah, those, we have Curaleaf. Sorry about that. Curaleaf. We have Leak Busters, which is a roof repair company. We have Fluent, which is a dispensary, and also Liberty Health Sciences. So they will have breakout sessions where they will talk about, maybe do a demonstration. Dr. McCain will be doing an educational presentation, as well as our other Dr. Nick Lezama. He will also be doing an educational presentation that day.
So when we met to talk about this, the COVID was in the very background. it wasn't a thing. Now it's a thing. So what we're going to do is we're going to say when the event is, but you're going to be updating your website in case it gets postponed. But what is the date right now and the location?
As of right now, it will be April 19th, which is a Sunday, from 2 o'clock until 6 o'clock at the Knights of Columbus on Ravenswood in Port St. Lucie.
Mm-hmm.
And we do have a Facebook event page that anyone who has been invited to it, please share that. But also we will make updates there, and we're going to be adding more information to the website as well.
Okay, perfect. So in the event that it does have to get postponed, it's postponed. It's going to happen eventually because we're just going to get back to life as normal.
Exactly.
I'm just going to say very soon, and that's that. So before we go back into a question, I want everyone, though, to know that Treasure Coast Printers is one of the sponsors of this show, and they are a one-stop shop for your printing needs: business cards, brochures, flyers, banners, signs. TreasureCoastPrinters.com, 772-202-2721. They are fast, they are local, they are competitively priced. They are just wonderful. TCC 2020 is a promo code, 10% off your entire order. So thank you very much for that. So now what I want to talk to you about, we spoke about the festival. Dr. Nick Lizama is one of your associates. I had the pleasure of meeting him at your open house. I have to say that he is so calm and you know, I just know that people are probably so happy to be sitting with him and with you, just the level of comfort and care that he exuded. And he's also a veteran. He was in the Air Force.
He was actually an ER doctor in the Navy and in the Army as well.
Okay.
So,
sorry.
Yeah, no, for I think more than 2 decades he served, and then he was in the Veterans Administration. And so he has a particular interest in helping veterans with their complex traumatic injuries that they've sustained. So that's one thing. We also do offer, with Nick Lizama joining the team, a veterans discount. So
everybody loves discounts.
Mm-hmm. And we love our veterans.
Well, wonderful. So one thing, though, I do want to ask you, very important, is a success story. So for people that are watching and listening, get your Kleenex out, please.
I really want to emphasize that the listeners, unfortunately, and the legislators will never really truly understand to the depth that I do, given the confines of a very private physician-patient relationship, the benefits that cannabis can have. And some other doctors and people may not understand because they say that it's just anecdotal story. But the truth is, like, I'm going to consider a medical marijuana success when the quality of life is improved. And what I mean by that, we're talking about the person who was on SSI, permanent disability, being able to return to work for part-time, you know, regaining personal pride. A person that used to need an ambulance, like a cane, a device to help them walk, no longer needing that. It's the MS patient who relapses and has remissions who's able to gain their life back. A cancer patient who didn't give up treatment because the side effects were so terrible. They saw it to completion, and now they are in remission. We see lab markers go down in autoimmune conditions. And just, again, more practical examples that maybe are not calculable for data, but it's the Crohn's disease patient who can plan a trip without where they're going to stop at every bathroom break. Wow. Or the golfer who doesn't need a caddy because his tremor is controlled to put his own ball. I mean, this is pride, this is independence, and this is what patients can get out of using cannabis. It doesn't have to be so dramatic, but we do see families that are not getting divorced. They have the physical and mental abilities to be with their family, however long that may be. I really enjoy July 5th. Because it's the day after July 4th, of course. Right. And what we get is a lot of thank you notes from veterans saying, you know what, this is the first year I wasn't like curled up in a ball in my house. I was out enjoying it, seeing the beauty with my family. And last year, I mean, this is why I keep doing it. I had 5 patients and they don't have to volunteer this information. They're leaving and they say, I didn't commit suicide because I met you. And this is great.
So that alone, like that is major. You know, like when you were talking about July 5th, that brought me back to our meeting and like how amazing it is that people are not terrorized on July 4th, but people who were going to commit suicide. That you've really saved people.
I do. I feel like it's such a rewarding part of my career so far.
Okay, so I know that I'm leaning forward. I know there's people watching and listening that are leaning forward. So again, please give out your contact information.
Sure. And our website also does have some recorded videos under the FAQ section about the legalities, about the science of cannabis to prove that it is really medicine, and actually about instructions on how to use it, how to read the labels and find the right products. So we encourage everybody to watch over those videos. It's www.socommjclinic.com.
Wonderful. So, and Veronica Kolobab, Director of Business Development. So you are amazing when it comes to social media and connectivity. So you're going to update. And we are out of time.